You feel foggy. You can't focus. You feel tired but wired. You've probably Googled ADHD symptoms or chronic fatigue 100 times. But what if I told you the most common psychiatric intervention I see isn't a stimulant and it isn't an antidepressant? It is iron. And here's the scary part. You can have a perfect blood test from your doctor and still have a brain that is starving for oxygen. We think of ADHD as a dopamine problem, but dopamine doesn't just appear out of nowhere. It has to be built. Your brain is a factory. To build dopamine, it uses an enzyme called tyrosine hydroxylase. Think of this enzyme as the main machine on the assembly line. But this machine has a power source. That power source is iron. Without enough iron, the rate-limiting step of dopamine synthesis fails. The machine slows down. It doesn't matter how much fuel you eat. If the machine is broken, you don't get dopamine. But Rami, you say, my doctor checked my bloods. My hemoglobin is normal. This is the trap. Your brain is locked behind a strict border called the blood-brain barrier. This barrier decides what gets in. It is entirely possible to have normal iron levels in your body, but low iron availability in your brain. Your blood is full, but your brain is starving. How do you know if this is you? Look at your legs. Dopamine levels naturally drop at night. If your factory is already running on low iron, this nighttime drop causes a system crash. This manifests as restless leg syndrome. It's that creepy, crawly feeling that makes you want to kick. If you have ADHD symptoms during the day, plus restless legs at night, you might not just be hyperactive, you might be iron deficient. So why do doctors miss this? Because they look at ferritin. Ferritin is supposed to show your iron storage, but ferritin is also an acute phase reactant. That is fancy doctor talk for it goes up when you are stressed or inflamed. If you are stressed, sick, or inflamed, your ferritin number goes up, artificially masking the fact that your actual iron stores are empty. This happens constantly to women who are told they are fine while struggling to function. Before you jump to a new diagnosis or a stronger prescription, ask yourself, does my brain have the raw materials to even work? Don't just treat the symptoms, fuel the factory. Subscribe for more science that fixes your biology.